Okay, so let's get started. I like to just give you a little bit of information about me. So my name is Kiana Craig. I was born and raised in New York. I have 21 years of healthcare experience and 14 years of medical billing experience. I have an associate in applied science in medical administration, and I'm a certified billing and coding specialist by NHA. I am the owner of Express Medical Billing and Consulting LLC, which I formed in 2008. And I have worked in the following specialties: emergency medicine, urology, plastic surgery, internal medicine, dermatology, speech language pathology, breast surgery, psychology, obstetrics and gynecology. And medical billing has changed my life. It gave me everything I was seeking. My priority was flexibility. I wanted to be able to set my own schedule and be present for my children. It has also been very profitable. I've been earning six figures consistently since 2006. And it's very convenient. I've been able to work from home, which I've been doing for the past 6 years since 2014. Okay, so what is medical billing? Medical billing is a process of creating and submitting a claim to an insurance company for a healthcare provider to receive maximum reimbursement for services rendered. In simpler terms, it's translating a medical service into a billing claim. It's very easy to learn and does not require a college degree. You can work on site at the provider's location or remotely from home. There are many different types of providers. To name a few: MD, medical doctor; LCSW, licensed clinical social worker; SLP, speech language pathologist; DC, chiropractor or doctor of chiropractic; NP, nurse practitioner. It consists of a lot of data entry and follow-up calls. You have to be very comfortable with computers and talking on the phone. Skills that will help you succeed are being organized and detail-oriented. Okay, so this is the revenue cycle, which is the life of a patient account from creation to payment. We're going to start at the top of the black arrow, and it begins with patient scheduling and registration. So right now, if I were to call my doctor's office, they are going to register me over the phone. If I were a new patient or even established, every time I call now to make an appointment, they're going to verify your full name, date of birth, address, email address, phone number, and your insurance. They're going to want all that information up front so that they can verify that you have the active coverage before you even come into the office. Okay, so that's the next step, insurance verification. Then once you arrive to the office, they should be collecting the copay at the time of service. After, you will see the provider, whether you have a patient exam or consultation. And then after that, the provider will complete a Superbill. It's also called an encounter form or fee ticket. And that is where they will mark off the charges. So they should be selecting procedure codes, whether they're CPT or HCPCS codes, and diagnosis codes. Okay, so that will be given to the biller. The biller will do a claim review and make sure that all of the codes are correct and add any necessary modifiers, and then submit the claim. After submitting, the insurance company will receive the claim, process the claim, and issue an EOB. An EOB is an explanation of benefits, and it just breaks down the way that the claim processed. So if the claim paid, and you would post the payment. If it denied, you would research the denial reason. Normally it is on the EOB, it'll tell you why. But if you have any questions, you can contact provider services and inquire about the reason. They will assist you, and you can submit a corrected claim or possibly file a denial. Possibly file an appeal if necessary. The next step is AR follow-up, and AR stands for accounts receivables. You want to run your AR report every 30 days, and that's just checking for any outstanding claims. You want to follow up on those claims and any outstanding balances by the patient. And then patient statements. You want to issue these statements to the patients after you receive the EOB or ERA, and that just lets them know what their responsibility is, what their outstanding balance is. And those can be sent by mail, by email, or even text. Okay, so this is the life cycle of a patient account from creation to payment. Okay, this is an example of a demographic sheet. So this is what I was referring to before. Right now, if you call probably most of your providers' offices, they're going to collect a lot of this information up front. But once you're physically in the office, they may have you complete this demographic sheet. And again, it's your name, date of birth, address, phone number, email address, your emergency contact. They may ask for your primary care physician information and your insurance information. Okay, this is an example of a health insurance card. Okay, on the front of the card, they will have the member ID, and some of them also have a group number. It'll have the member name. It may have the PCP or primary care provider, primary care physician. It may have that on there as well. And then there should be an area where they explain the copay for a regular office visit, specialist, ER, possibly for urgent care, but that will be listed on the front as well. And then there's the payer ID. The payer ID is just an electronic number for each insurance company, and that's needed so that you know where to send the insurance claim. Okay, and then on the back of the card, you would pay attention to provider information, and that's going to give you the provider services phone number if you have any questions about benefits or claims. And also the PO boxes on the back. If you ever need to mail a claim or any correspondence, you would send it to this address on the back of the card. This is an example of a Superbill, also called a fee ticket or encounter form. And at the top, it's going to have the provider and the practice information. It may also have the patient name, date of birth, their insurance. It should have the date of service that they're being seen. And then again, the provider will complete this form and they'll mark off whatever codes are appropriate. So it should have, again, a CPT or HCPCS code and a diagnosis code on here. Okay, some Superbills have the diagnosis codes listed on here. If not, in this bottom right corner, the provider will just put the code there or write the diagnosis there. This is a paper version, but a lot of softwares now that are cloud-based do have an electronic version. Okay, this is an example of a HCFA 1500 claim form. This is used by professional providers. Okay, this is a sample, and the information that you're inputting into the practice management software, it's going to look like this on paper. Okay, so again, it's the patient information, name, date of birth, address. And over on the right, it's the guarantor's information, the member ID number. In this section here, it's the diagnosis and date of service, place of service, and those CPT or HCPCS codes. Modifiers would go here, total charges, rendering provider NPI, and the billing provider's information goes down here. So everything that you're inputting, all the data entry that you're putting into the system is going to generate on this form. You're going to submit claims electronically 9 times out of 10, but if you need to print it on paper, this is what it would look like. Okay, this is an example of an explanation of benefits, also called EOB or EOMB, explanation of medical benefits. And this is what the insurance company is going to issue after they process a claim. So it's going to have the provider or practice information at the top, and then it should have the patient information as far as name or member ID, and it will break down the way that the claim process. So it'll have the date of service, the charges that were billed, it will tell you the allowed amount, the paid amount, and any patient responsibility. Okay, so patient responsibility could be a copay, deductible, or co-insurance. Okay, and then also on the EOBs, there are remark codes. So if there are any denials or anything that they want to inform you about, there'll be a code. And on the bottom of the EOB or the back, there's normally like a glossary. It'll tell you what each code means. Okay, but again, if you have any questions, you just contact provider services and they'll explain the processing of the claim. This is an example of a patient statement. So again, at the top, it's going to have the practice information and the patient information where the statement is going. And it will break down the charges, what was submitted to the insurance company, what was paid, and any patient responsibility. Okay, so we're going to move on to Metasoft Practice Management Software. I'm just going to share my screen. Just confirm when you can see that. Okay, it's a blue screen, and at the top it says Metasoft Network Professional. Okay, great, thank you. So we're gonna go into everything from beginning to end. So we're gonna create a patient account. We're gonna enter charges. We are going to create a claim, submit a claim. We're going to receive the EOB and post the payment and send a statement to a patient. Okay, so I'm going to create a new patient and their name is going to be Mary Doe. I'm going to put in her address. I'm going to put in her email. Her phone number. I'm going to go down to her date of birth. And with this software, they make you select a provider. So we'll select a provider and put in the date. Okay, then we're going to save. Okay, so that was all the demographics. We're just going to also add her insurance here. They make you create a case. I'm going to put GYN because she's a gynecology patient. I'll select the facility and her insurance. She is Oxford. So we're going to put in her member ID and her group number and save. Okay, so we entered all her demographics. Now we're going to move on to charge entry. So let's say the provider gave me the Superbill, and let's just say she was seen today. She's a new patient. So we're going to give her a 99203, which is a new patient level 3 visit. And we're going to make that $450. We're going to give her a diagnosis code. We'll just choose anything. And then the second line item is going to be an ultrasound. And for the ultrasound, we're going to say it was $350. And okay, so with this claim, we're going to add a modifier to the E&M code, evaluation and management code, which is the office visit code. Okay, this is going to prevent that office visit code from bundling with the ultrasound code. If we were to submit it without this modifier, some insurances would process the claim and bundle the office visit with the ultrasound and just pay for one code, but we don't want that to happen. So we'll add the modifier 25 and it lets them know this is a separately reimbursable charge. Do not bundle it, and they should process both codes for payment. Okay, so we created our claim, or we entered our claim. Now we're going to create the claim. Okay, so the date of service was today, and our patient is Mary Doe. Okay, so this is the claim right here. Okay, this is a tutorial account, so it's not going to let me do the next step, but the next step would be to have the claim scrubbed, and that's just checking to make sure that it's clean. And a clean claim means that there are no errors. Everything looks correct. There's nothing missing. It's ready to go out to the insurance company. So the next step, I would have just pressed the button. It would check the claim and let me know if it was clean or not. If it came back green, that means it's clean. You can submit it. And if it came back red or yellow, it would give me the reason why. I would go back and make whatever necessary corrections, scrub it again, and then once it's green, I would submit it. So let's just say I submitted the claim, it went out. A couple weeks later, we received the EOB from the insurance company. And okay, so we're going to select that it came from the insurance. It's a check. We'll put in the check number. I'm sorry. We'll put in the check number here. And let's say the check amount is $600 from Oxford. That's her insurance company. Okay, this account doesn't default these codes, so let's see. Let's just choose one and see what happens. Okay, so we have our Oxford payment for $600. We're going to apply it to our patient. Again, her name is Mary Doe. We'll select Mary. Okay, it's telling me I have Mary's account open, so I have to close her account first. And then we'll go back in. Okay, here we go. So this is the claim. We have our EOB, and we're going to go line item by line item. So the first one, again, is the 99203. That's the office visit. We submitted a charge for $450. The insurance company allowed $350, and they paid $300. Okay, so we're going to enter that they paid $300 but allowed $350, and we're just going to tab over. It leaves a remaining amount of $50. Okay, the $50 is actually her copay, which she didn't pay at the time of service. So when we're done, we're going to create a statement for her. The next line item is the ultrasound. We billed $350. They paid $300 and also allowed $300. So there's no remaining amount due. Okay, our only remaining amount is that $50 copay. So we're going to go ahead and save and create that statement. Okay, we're going to select the statement type that we want. We'll bring up her account again, Mary Doe. This is the date of service. And this is what the statement would look like. Again, at the top, it's going to have the practice information and then the patient information. And it's going to let her know what charges she's being billed for and the reason why. Okay, so she owes $50 for her copay. Okay, so that's the entire process. We created a patient, we entered a claim, we submitted a claim, we posted a payment from the insurance company, there was a balance, and we created a patient statement. Okay, so I'm just going to switch over back to the presentation. Just let me know when you can see that screen. Okay, we should be back at where it says Metasoft, and it's a picture of the practice management software. Just let me know if you can see that.
Yes.
Yeah. Okay, perfect. Thank you. Okay, so we're done with that. Now, let's talk about the equipment that you need, okay, to get started. If you're medical billing from home, it's going to be the same equipment that you're using in the office. So simply, you just need a computer. It could be a desktop or a laptop. Either one, it doesn't matter. Most softwares are internet-based or cloud-based, so you just need the internet. The type of computer and all the specifications don't really matter. That was used like years ago when you had to download actual software and programs onto your computer. So as long as the software is internet-based, it doesn't matter what type of computer you're using. You're going to need a phone, so landline or cell phone, either one is fine, and a multifunction machine. You're going to need to be able to print, copy, scan, and fax. Okay, so let's talk about what's next and what you would do to get started after here. Okay, so if you're interested in learning more about medical billing, if you have any further questions, you're more than welcome to schedule a free 15-minute consultation. Okay, if you are interested in actually getting started and maybe looking for providers or starting your own billing company from home, you can schedule a coaching call. Okay, you can schedule 30 minutes or 60 minutes, and you utilize this time however you like. If you want to discuss, how to start a business, how to find clients, maybe you want to do a resume audit. Maybe you're not getting any responses and you want to go over your resume. We can discuss interview tips or even train on practice management software. Okay, I do offer a 6-week online medical billing course. It's called Biller Bootcamp. It's $999. This bootcamp is a live online course that teaches you everything you need to know to become a medical billing expert. Okay, during this affordable 6-week course, I will guide you through a number of interactive lessons and discussions to prepare you for the certification exam and for a successful career in medical billing. Soon to come are ebooks, and some of those topics are going to be key medical billing terms, what is medical billing and how to submit a claim, how to start your own medical billing business from home, it'll be a step-by-step guide, and how to find medical billing providers. Resume samples and interview tips will be included. Okay, this is all of my contact information. I am Ask the Biller on YouTube, Facebook, and Instagram. My website is justaskthebiller.com, and my email is askthebiller@gmail.com. If you're looking for a group to network with, I've teamed up with the amazing Tamasia Alston, and we formed a group called Billers and Coders United. So that is on Facebook. If you're looking to work from home or take a certification course, maybe you're looking for career coaching, you want to start your own billing company, or again, just to network, you definitely want to join our group. Okay, so now I'm going to open it up for the Q&A. If anyone has any questions, feel free, you can put it in the chat, and then I can call on you, and you can take yourselves off mute, and I'll be happy to answer any questions that you have.
Can I ask by, hello, hi?
Hi, how are you?
I'm good. My name is Hamid. So thank you very much. And so I'm new to billing.
Okay.
So I want to ask, where do I start?
Well, if you have never done billing before, you'll need to take a billing course. Okay, you'll definitely need some instruction and some guidance on, everything in regards to medical billing. You're going to have to learn. Okay, so once you get through that course, then you can start with maybe an entry-level position. You're going to need some experience. So you can look for an entry-level position. A good position to try to get is maybe with an actual billing company. They are willing to hire new grads because they will train you. And that's something that you're looking for. It's hard to secure a position right after you take a program. So starting with like a billing company or an internship or even volunteering, those are ways that you can get into the field so that you can gain some experience. And it won't take you very long. It's like I said, it's easy to learn, but you'll need some experience. I mean, even 6 months experience should be enough for you to get a good handle on it. And then, if you're interested in working remotely, you can start to look for your own providers to do billing for.
Okay, thank you.
You're welcome.
And so does the $999 for the
Yes,
6-week course?
Yes, the online billing course is $999. You do not need to spend tens of thousands of dollars on, a really expensive program. Although, you will make an immediate return on your investment. Once you get a job, you will make the money back, but I wouldn't advise anyone to spend, the amounts of money that I've heard programs are charging. So I've made it very affordable. And it's also, a short accelerated program so that you can get out there sooner than later. If anyone is interested in starting today, I will send them a coupon code, a discount code, so you can get a discount off of the course, but it is $999, okay?
So is it cash? Is it, do you have to pay it like cash? Do you have to pay it, right then and there before you start?
Well, if you want to make a deposit, the next course doesn't start until the week of July 5th. So if you want to make a deposit, you can do that as long as the course is paid in full halfway through the course. I'm willing to work with you. That's fine. Okay. You can send me an email if you're interested. You can definitely send me an email at askthebiller.com. I'm sorry, at askthebiller@gmail.com. Okay. Just let me know you're interested. I'll send you a discount code. And, that'll take a little bit off of the price. You can make your deposit and then, just make your payments towards it.
Okay, thank you.
Okay, thank you.
So within the 6 weeks, so within the 6 weeks, you'll be able to understand and know how to do billing.
Absolutely. Yes. Medical billing is not difficult to learn. Now, let me just clarify. Medical billing is not medical coding. Medical coding is something completely different. You know, they work together, but medical coding is something different. That's when you'll need, more extensive training. You'll need to learn medical terminology, anatomy and physiology. That's when you're actually going through the medical records and you are deciding the most appropriate codes. Medical billing is when the codes are provided for you. So it's mostly data entry. Okay, so I just want to clarify, medical coding is
Okay.
something completely different. But medical billing, yes, you can learn that relatively quickly in this 6-week program. And at the end, you will be ready for employment.
Okay. So if I'm certified with you, I can get a job. If like your certification can qualify me to get a job.
No, I do not have certification. The certification,
Okay.
I'm assisting you prepare for the certification exam. And that's going to be through
Okay.
one of the companies like AAPC or, HEMA, one of the other companies. But I do not provide certification. I'm preparing you to
Okay.
take the certification
Okay.
exam. Mm-hmm.
Miss Craig,
Okay.
I have a
Okay.
question.
Okay, thank you. Go ahead, Natasha.
Yes, thank you. This was actually really informative and very insightful. But my one question, are medical billers, are they required to be certified, or does that kind of vary? I wasn't really sure about that. I get that, of course you need, the understanding and all of that, but are you
Mhm.
required to be certified?
No, you do not have to be certified. Now, it depends on the type of position that you're applying for. I work for professional providers. I work for doctors, therapists, private practices. That type of billing does not require certification. Now, if you're going to be looking to work in a facility or a hospital, they are definitely more likely to ask you for certification.
Got it. Okay. So you do work for them. So and you have your own business.
Yes.
Okay. Got it. Thank you.
You're welcome. No problem. Yes, I have a medical billing company. It's called Express Medical Billing and Consulting. And under that company, that's where I do the billing for 5 different practices. What it is, the other company that you're probably thinking of is Ask the Biller. That's where I do training. I do medical billing training and coaching.
Got it. Okay. And do you outsource any of your work or have employees under you, or is this something where you primarily do it on your own? Because I know you said you've been doing it for about 6 years from home, etc.
Yes, I do not outsource. I do have one full-time employee.
Okay. All
hmm
right. Okay. Awesome.
Yes, thank you. Thank you for your questions.
Thank you.
Yeah.
No problem.
Yeah. Thank you. She really asked a great question because so you can work, so you don't need a certification if you don't have to work in the bigger companies.
Right. If you're not working for a facility or a hospital, those are the type of
Right.
providers that are going to require you to be certified. But if you're simply working, maybe you find a small group, a small, I don't know, an internal medicine group or a speech
Right.
pathologist, those type of providers don't require certification. No.
Okay. Yeah. Thank you.
You're welcome. Any other questions? No? Okay.
Yeah.
Like I
So far, so good.
okay. Yes.
This is Alicia. I have a question. I'm
Sure.
a certified coder. So
Okay.
if I wanted to be certified in billing, would I have to take that certification again, or would my coding certificate be sufficient?
No, it's not sufficient. You would have to take the certified professional biller exam. That's with AAPC. But whatever company you would go through, you would take their billing exam. So coding is something very different from billing. So
Okay.
that's why 2 different certifications.
Okay. All right.
Mhm.
Thank you.
You're welcome. You're welcome. So again, if anybody's interested in taking the 6-week Biller Bootcamp course, you can send me an email at askthebiller@gmail.com. And if you sign up today, I'm happy to send you a discount code to take, some money off of that course. And if you have any questions, feel free to reach out to me. I would appreciate any feedback about the webinar. If you don't mind leaving that on social media, on Instagram or Facebook. If you want to leave a brief review about the webinar today, I would greatly appreciate it. If there are no other questions,
Okay.
that is it. Mhm.
Miss Craig, I have one last question. I'm just
Sure.
out of curiosity, how did you get into it? I know you stated earlier that, you had flexibility and whatnot, but, like, how did you get into medical billing? Like, what kind of prompted you for this
Sure.
industry?
Sure, I'd be happy to tell you. So I started my healthcare career back in 1999. I was working, my first job in healthcare was an emergency room registrar. So back then they called it the emergency room. I know now they call it the emergency department, but I was an ER registrar. I worked there for a couple years and I fell in love with healthcare. After that, I moved on to a couple different practices, urology, neurosurgery, just doing, front office, authorizations, office management. And then I moved on to an OBGYN group who was outsourcing their medical billing, but the medical billing company wasn't doing a great job. They were having a lot of denials for untimely filing, which is unacceptable because you have at least 90 days to submit a claim. So if they weren't getting the claims out within 90 days, that means that there was a serious problem. So I used that to my advantage and I went to the doctors in the group and I offered to do the medical billing for 3 months free of charge. So I had no billing experience, but I had had 6 years prior of healthcare administration experience. I knew that medical billing was relatively easy and that I could probably learn. So I just took a chance, honestly, and I just offered the 3 months free because I knew what they were paying that billing company. That billing company was making several $1,000s every month. So I knew what they were paying them. I said, let me offer it free so that they have that savings and they give me that opportunity. And they actually said yes. So ever since then, in 2006, I've been doing medical billing. That's how I got into it. I taught myself. I didn't take any course or anything. I taught myself.
Awesome, thank you.
You're welcome. You're welcome. So it is very easy to learn. It's not difficult. I do want to stress, like I said, that it's not coding. Coding is something completely different where you definitely need education and certification. Okay, but billing is relatively easy. It can be very profitable. Okay, I'm making the 6 figures because I have multiple providers. Not to say that you can't make it with one provider. I mean, maybe if you find a very large group or facility to do billing for, you can. But I am juggling a couple different providers and working comfortably from home. So it's definitely a possibility, especially now with everything going on with the virus. There are a lot of positions online specifically advertising for remote medical billers. They're telling you that you can work from home. Okay, a year ago, you would definitely not see that, but now it's very common. Okay, so the opportunities are definitely there.
Do you work for providers nationwide or just in your state?
I work for providers in 2 different states. I'm definitely open to other states, but so far just New York and New Jersey. But you can work for any type of provider in any state across the country. So you don't want to limit your searches when you're trying to find them.
Okay, thank you.
You're welcome. Any other questions?
One last question. So the providers that, when you say that those positions are out there online where you have where you can work from home, the remote positions,
Yes.
in those positions, do they require certification or is it just basically working from home?
It depends, but again, everything that I've seen that I look at online are professional providers. Okay, that means doctors, therapists, that sort of thing. They're not facilities, not hospitals, nothing like that. I have not seen any ads that state, or maybe a few, but it's not common that they want you to be certified. As long as you have the experience, that's okay.
Okay. All right. Thank you.
You're welcome. You're welcome. Anything else? Any comments, any questions? Anything else? If not,
This
again,
was
if you
really
don't
good.
mind,
Thank you so much.
you're welcome. You're welcome.
Yeah,
If you
thank
would leave,
you.
Yes,
you're
extremely
welcome.
insightful.
Thank you. Thank you. If you would leave a review online, if you follow me on Instagram and leave a review on my post today, I would greatly appreciate it.
Okay, I will.
Yeah, yeah. Yes, I'll follow in a minute.
Yes,
So I'll screenshot your Instagram and your Facebook info. So I'm gonna start following you.
yes, please do. Ask the Biller. That's my name on Instagram.
Okay.
And I'll just tell you, somehow I was on Instagram the other day, and
Mhm.
I guess you must have put an ad or something, and it like popped up. And I was like, oh, okay. So then I just started following you, and here I am at your webinar. So that
Thank
at least paid off to some extent.
Thank you. I appreciate you letting me know. The ads are working. Thank you.
Absolutely. And I'm nowhere near New York or New Jersey. So
Okay. Okay, good. That's good to know. I'm gonna keep promoting them.
absolutely.
Thank you, Natasha. Thank you, guys. I appreciate it. Erin, Pam, everyone, I appreciate your time. Alicia, I can't see who else is on here. That's why I just mentioned those names. But everyone who's on here, I appreciate your time. Thank you.
Thank
No
you.
problem. You're welcome. Thank you.
You're welcome. Take care. Enjoy your weekend.
You too.
All right. Thank you. Bye.
Bye-bye.
You too. Bye.